Pre-participation health screening is for exercise professionals that works with certain individuals. In order to begin the process, you have to screen the individual before initiating physical activity or before building an exercise program. The individual must be medical cleared before beginning an exercise program. You can determine whether the person is cleared by using the ACSM screening algorithm and with the help of a qualified exercise or healthcare professional. During the screening, if it comes about that the individual needs medical clearance, it should be cleared by the primary doctor, internist, or cardiologist before anything takes place. The major signs or symptoms of cardiovascular disease, metabolic, and renal disease are pain, discomfort in the chest, neck, jaws, and arms. Normally, it's like a dull ache, sharp, or stabbing pain. Another one is shortness of breath at rest or malexertion, dizziness, and dizziness after exercise should not be ignored at all. Some more major signs and symptoms are ankle edema, the swelling of the ankle. Palpitations or tachycardia is the rapid beating of the heart. Intermittent claudication is the pain that occurs in the lower extremities with an inadequate blood supply that happens because of the exercise. Known heart murmur and unusual fatigue or shortness of breath with usual activities. Self-guided methods is basically the PARQ, which is used as a self-guided exercise participation hub screening tool for professionals that may want additional screening notes. This is what exercise professionals use to identify individuals that are at risk for cardiovascular disease during or after aerobic exercise. For starters, you can identify the individuals by determining who participate in exercise regularly and who don't. The exercise program is divided into 3 exercise intensities. The lower intensity exercise is 30 to 39% heart rate reserve, an intensity that causes slight increases in heart rate and breathing. The moderate intensity exercise is 40 to 59% heart rate reserve, which causes noticeable increases in heart rate and breathing. The third one is vigorous intensity exercise, which is greater than 60% heart rate reserve, which causes substantial increases in heart rate and breathing. Okay, now back to the ACSM pre-participation screening algorithm. So it is always best to know who do not participate in exercise regularly because it is easier to point out the ones that may have an increased risk of complications. The ones that have participated in exercise should have a history of physical activity of at least moderate intensity for at least 30 minutes or more on 3 days or more days per week during the last 3 months. So the second part is classifying the individuals that have the known cardiovascular disease, metabolic or renal disease, or the signs and symptoms of these diseases. They should be asked if they have ever been diagnosed with these conditions before. Once everything is all worked out, the next step is determine what desired exercise intensity is best for the individual. Vigorous exercise or more intense tends to trigger acute cardiovascular events versus if they started with light to moderate exercises. Identifying the proper exercise intensity is extremely important. Individuals that are healthy and have no signs and symptoms are cleared to start with light to moderate exercise intensities without being cleared. Symptomatic individuals who don't participate in exercise should seek medical clearance before starting. The ones who exercise already and don't have no signs and symptoms can proceed with their current exercise intensity or even increase. The ones who have already have a known disease but no signs and symptoms and exercise can proceed to what they're doing. But those who exercise already but experience signs and symptoms should discontinue and get medical clearance before doing anything next, no matter what the intensity is. When exercise professionals use the algorithm, they should monitor it at all times for changes. For example, individuals that were experiencing those symptoms may now start to experience those symptoms.